Buenas tardes. Gracias por acompañarnos hoy aquí para celebrar esta importante victoria para la salud de la mujer. Woo, woo. My name is Celinda Vasquez, and I serve as Vice President of External Affairs at Planned Parenthood Los Angeles, and I will be acting as our MC today. I'll ask the media if they're here to hold any questions till the end. We'll do a Q&A at the end of the program. And before we begin our program, I want to acknowledge El Proyecto del Barrio for graciously hosting the event today, and of course for all of the work that you do every single day. A huge thank you for making this happen. As a working mom myself, I know just how difficult it can be to plan and keep multiple appointments, and how big a decision around parenthood is. That's why I am personally thrilled to be here representing Planned Parenthood Los Angeles and standing alongside so many other leaders in reproductive justice and healthcare access. And without further ado, I'd like to introduce our first speaker, Corinne Sanchez, President and CEO of El Proyecto del Barrio. Corinne Sanchez has been the president and CEO of El Proyecto del Barrio for the past 38 years. And Corinne's leadership and vision has contributed to the remarkable growth of the organization. El Proyecto has expanded its services to the entire San Fernando Valley and San Gabriel Valley, a service area that encompasses 400 square miles and serving an estimated 50,000 people annually. The organization provides a wide spectrum of services, including primary health care services, employment and job placement services for youth and adults, and preschool services. Just amazing. The work that they do touches many communities, and access to health care, including birth control, is a common need. That's why Proyecto del Barrio proudly supported SB999. So please help me and welcome Corinne Sanchez.
First of all, I want to welcome everybody here today. I am so proud to host this event. And just a little tidbit, I am from the 70s generation, feminist women's movement, Latino movement, civil rights movement. So this is a full circle. I believe in this in the bottom of my heart, and from all the work we've done when I was in college to now my adult years. I'm so proud El Proyecto serves both Bob Hertzberg's district and Fran Pavley's district. As stated earlier, we also are in the San Gabriel Valley, but this is where our heart and soul is, in the San Fernando Valley. We feel this is really critical. A major population we serve is Latino and poor women and their families. It is so difficult for our women to make doctor's appointments, to tow their children around, to get prescription contraceptives that helps her then plan her family. And so this is like hitting at the heart of it, and I'm so excited and supportive of it. We look at a woman who's probably 30 years of our lives are taking birth control pills or some kind of prevention from getting pregnant, but also we make about, out of the 30 years, we're talking about 360 visits of our life to doctor's offices to get prescriptions. So it's going to make our life as women easier and happier, and it'll make the whole family more facilitated in what they do, whether it be in job or school or activities in our community. So the key is El Proyecto, I, Corinne Sanchez, support SB 999, and I have for the past many, many years. So I want to say that I'm proud that Bob and I go back, and that he's been supportive of this as well. He is a feminist as well. And of course, Fran Pavley, who has led the fight on this, I give you major, major kudos, and I'm glad to be here with you. Thank you so much.
Thank you, Corinne. Senator Fran Pavley is completing her 14th year in the legislature. While her service as a lawmaker has been widely celebrated for her leadership in authoring California's groundbreaking policies to reduce climate pollution and promote clean energy, She has also been a champion of protecting women's and children's health, requiring safeguards for breast cancer surgeries, improving services for the developmentally disabled, and preventing sexual assault and domestic violence in our communities. Wow. This year, the sponsors of Senate Bill 999 were thrilled when Senator Pavley stepped forward to author this important new law to make birth control more consistent and effective. We knew her reputation as an effective policy-oriented state senator, and just as we knew she would, she delivered, and the governor signed the annual dispensing bill into law. Woo, woo. Senator Pavley is someone who has spent 25 years as a classroom teacher before going into public service. And let me say this in a way I know you'll appreciate. For your work this year in improving women's reproductive health, you get an A++. Please welcome Senator Fran Pavley.
Yes, thank you very much for that introduction. And I didn't know they gave A++, but I'll accept that as a former middle school teacher. It's a pleasure for me to be here. And isn't this exciting? I mean, I was talking to Bob Dexby. How many years ago you were on this journey trying to pass sort of similar legislation? Timing is everything, and we did sort of joke together, although I'm somewhat known for some of my environmental and air quality bills and climate change bills, that this indirectly will help clean up the air because it's less trips to the pharmacy in your polluting vehicle, so it all works together, right? I think it could qualify for greenhouse gas emission reduction funds. Just submit that, Mr. Hertzberg. So thank you very much. I wanted to take this opportunity to thank my staff because actually they do all the work behind the scenes. So 2 are down from Sacramento, and those bills that you just mentioned on domestic violence or sexual assault, or Dee Elise Thoreau is my ledge director. She does an amazing job. Where's Elise? She's hiding in the shade over there. Now, even in the world of term limits, the good news is these champion policy staff people will still be in Sacramento, and she's been a go-to person. I think she worked for you, Bob. Now works for me. Must love the San Fernando Valley and San Fernando Valley legislators. So thank you for coming down. Matt, where are you? Flown down from Sacramento, my science fellow. And I think his wife will be thrilled with this bill. Will she not? So thank you very much. And Henry Stern, who worked for me for 4 years and is now on a sort of leave of absence, if you will. Thank you, Henry, for being here. Now, I'm not sure who's left in my district office, but my district office is over in Calabasas if you ever should need us. And we generally represent everything west of the 405 down the hill to the bottom of the Camarillo grade, Malibu to Magic Mountains, a small, compact little district. But who's here with me today from my district office, who's very supportive and exciting of this legislation? Lauren Gallant, my district director. Where's Lauren? Over here. Rosalba Gonzalez, who represents the San Fernando Valley for me. Rosalba. Sally Hibbets, who was a volunteer in my office, but crafted her in for these last few months, doing a great job. And she's the president of AAUW out in the Ventura County area, which was supportive of this measure. And Marie Lakin, who is here. She represents me in Ventura County, but she's passionate about women's issues, and under the other duties as yet to define in their contracts, she does all my Facebook, camera, media, etc., etc. So that's what happens when you work for a legislator. You have to be multitask. So where did this bill idea come from? You know, I have to admit, I don't take birth control pills anymore, so this won't be affecting me personally. So where did this idea come from? Came from very humble beginnings. Many of you know that legislators start thinking about legislation in the fall before the next session. So I want you to put that in your mind. So if you're thinking about bills that needed to be passed, this is the time to sort of zero in on who might be interested in carrying the bills, and they can do some research to see what would be the challenges or opportunities, finding an author. So this bill, the concept came from over 200 letters or emails that came into my office from women that lived all over the 27th Senate District in both Ventura County and LA County, describing some of the obstacles and challenges they had just finding time in their busy lives to go to the pharmacy. Up till next January 1st of 2017, many women were forced to, with prescriptions, renew them every 1 to 3 months, every 30 to 90 days, taking the time out of their busy schedule. And most women, are working, juggling childcare, trying to be conscientious about taking birth control pills. But, you're not allowed to miss these. This is not like other medication. And it has to be consistent and uninterrupted to be effective. So busy women are affected by this. They're going to be cheering for this bill, trust me on this. And also students going to college, at home versus away, and how you consistently have uninterrupted service. And rural people, we're finding more rural, especially lower income neighborhoods throughout California who have challenges to access to health care anyway, have an increasingly obstacle because of these, frankly, outdated laws. So I want to here today thank a few of the sponsors. We had 3 sponsors: Planned Parenthood, Essential Access Health, and Narrow Pro-Choice. So give it up for the 3 sponsors. Now, they spent time in the Capitol along with other advocates. So what does SB 999 do? It requires, it's a mandate, that's why the insurance companies weren't thrilled about it. It requires all health plans to cover up to 12-month supply of prescription contraceptives. And I stress the up to 12 months because that's relevant to the discussion when people say, shouldn't a doctor have some opinion on this? Or what about, someone who has some special situation, health problems? So it's up to 12 months. It's subject to the discretion of the doctor and their patient to make a good, conscious decision. Maybe that first time someone takes birth control pills, you're a little more conservative. Then after that, certainly a 12-month supply makes sense to me. So this is probably why the medical associations, all of them, California Medical Associations, doctors, gynecologists, physicians' assistants, and the list goes on, were all supportive of this measure because it took into account protecting the health of the patient, but also accommodating this need that they have to access birth control contraceptives in a logical, convenient way. So this was a simple change in law, but nothing simple in Sacramento, right? Insurance companies have power. They can be effective. I figured out one reason why this maybe, Bob, was successful now and not years ago. These bills now get sent to health committees. Elise was telling me that's a change. In the past, they would have been sent to an insurance committee who has their own biases. Trust me on that. I don't carry bills that go to the insurance committee because I'm usually on the wrong side of most of those issues. So studies show that annual supply of contraceptives reduces unintended pregnancies by up to 30%. It'll save the state and consumers money. The CHRB has decided that perhaps there will be 15,000 fewer unintended pregnancies and 7,000 fewer abortions. So this has been a bipartisan effort. We had a lot of Republicans supporting this bill, especially Republican women. They get it. And so here's the good news to sum it up. Governor Brown signed this bill, I think it was last week. That's good. But here's the really good news. Beginning next year, women in California will now have one less thing to worry about as they go on with their busy lives. So thank you very much.
Okay, so now I get to introduce, if I can gather my notes correctly, Senator Hertzberg. who really doesn't need an introduction because we all know. Okay. I numbered these notes too, but anyhow. So, Senator Hertzberg. Senator Hertzberg has been a strong supporter of women and women's health and women's rights his entire career. He was elected to the state Senate in 2014. Before that, he was our Assembly Speaker before terming out. And in 1999, which was mentioned earlier, he fought successfully for the Contraception Equity Act to require California health plans to cover contraception prescriptions. In the 12 years after serving in the Assembly, Hertzberg traveled the globe as a clean energy entrepreneur and worked to develop bipartisan good government reforms that have improved the initiative process and produced on-time state budgets. In the Senate, Hertzberg has focused on tackling some of our state's most challenging public policy problems, including better managing water and renewable energy, eliminating overly harsh traffic fines and punishments for the poor and working poor, and overhauling the state's outdated tax system in just 2 years. Senator Hertzberg says his guiding principles is to work on governing for the next generation and not the next election. Please welcome Senator Robert Hertzberg. You're welcome.
Thank you. Un abrazo por todo. Corinne, thanks for doing this. I really appreciate it. A lot of years together. A gigantic shout out for Franny. Man, she is just, I don't know what the hell we're going to do without her in Sacramento. I'm telling you, she leads on such extraordinary issues, does her homework. It's really impressive. She'll tell you the story that I just read actually again, that you talked about again, that you want to do education. I said, no, we need somebody on the environment. It's my fault. I'll take that all day long. And you can't say it, but I can. We together represent the San Fernando Valley, and come a few months from now, me and Henry are going to represent the San Fernando Valley. And I just want to say, it's hard to get her to the San Fernando very often, but I'm telling you, in terms of women's issues and really important stuff, Diane Griffiths is my chief of staff. She was the chief of staff to the Board of Regents. She was my chief of staff when she was speaker. She continues to be my chief of staff, and she was a lawyer for the legislature, for the Assembly. She's been around forever, and there's nobody smarter and nobody better. Diane Griffiths. And also, if I could just, also my district director, Barry Worth Cravan, is here. Eveline, where's Eveline? Eveline Bravo Ayala's here. We got a couple of interns, William and Bella. We got an army of interns in our office way in the back. I really appreciate you guys being here. My dad was a constitutional lawyer, and I remember as a kid, he handled the case in the California Supreme Court, I think, that dealt with the issue of whether women could be bartenders. I mean, common sense kind of thing, right? It was against the law for women to be bartenders. Raging kind of common sense thing. And it informed me in my thinking in so many ways, so that when I came to the legislature, my first employee, your employee that you praise, and who Diane Griffith gave to me, was Elise Thoreau. And Elise Thoreau, your point about these people whose names are not in the newspaper, but who are fundamentally engaged in the fight, who continually do the hard work and the big think. For 56 years ago, the Federal Drug Administration approved the pill, approved birth control pill. But they weren't approved by insurance companies to pay for that. And so Elise, 21 years ago, when she worked for Jackie Spear, worked behind the scenes on AB 1101, and the governor vetoed it. Then it was Governor Wilson. That was in 1995. In 1996, the second Contraceptive Equity Act, fighting the same fight, but unfortunately, a different party controlled the legislature at the time, and it didn't make it to the governor's desk. In 1997, she was my person, and she brought the issue to me. I responded for the reasons that are informed by my background and my thinking. And we've introduced AB 160 in 1997, the Contraceptive Equity Act, vetoed by the governor. 1998, AB 1112, vetoed by the governor. You stand tall, you do not bend, you fight the fights. The right thing to do is the right thing to do, whatever the circumstances are of the day. And finally, in 1999, AB 39 was signed, the Women's Contraceptive Equity Act, which formed the foundation for 999, which is the idea that the insurance companies, because they cover Viagra, but they didn't cover other types of devices for contraception. And so when I saw this, Senator Pavley was so gracious to allow me to be the principal co-author of this, because it is a fight that is imbued in my who I am. And I want to just give us another. You gave a shout out for Elise, and you know what a rock star she is. I want to give another shout out for Elise Thoreau, who's incredible. You know, I just want to say it's interesting in government. You know, Fran and I, we fought a lot of fights over the years on so many issues, and it just never ceases to amaze me that you're sitting down, something as simple as this. This really is a GHG bill. This is a respect bill. This is a common sense bill. Are you kidding me? You have to go back every month or whatever. There's a government program that's involved in this regard, but it doesn't allow everybody to have this right. And yet you got to fight these fights, whether it is the insurance committee, whether it is other interests that choose to do what they do. It is one of the great lessons in government that's so frustrating when so many people, Henry, you're going to see this when you're up there. It's different being a member than being a staffer. You know, where people come to you and they tell you the rotation of the earth is going to stop if their little thing happens. And when you say, well, this makes a lot of sense, it's just, how do you explain it to voters? It's one of these things that for all of us here who've been in these fights for so long, we know how important these things are. But to the public, they look, well, why doesn't this happen? And it is what Fran says about the ideas of these interest groups and how they have influence in the process. And the bottom line, the same thing that motivated that fight, the same intellect and background that made that stuff happen, that we continue to fight. The answer to the question, I give this to Barry, although I'm not a USC person, fight on. Thank you very much. Appreciate it. Thank you for inviting me.
Thank you. I now get to introduce another organization at the forefront of fighting for reproductive justice and healthcare access. NARAL Pro-Choice California is committed to protecting and expanding healthcare access for all women in our state and eliminating all the barriers that exist to birth control and other services. For these reasons, NARAL Pro-Choice America co-sponsored Senate Bill 999 and worked hard to ensure its passage. Please welcome Rebecca Griffin, Assistant Director of California Programs at NARAL Pro-Choice California.
Right up here. Thank you, everyone, for being out here in this extreme heat to celebrate with us today. This is a great victory for Californians, and it shows that California respects reproductive freedom with actions and not just with words. There's no such thing as economic security without reproductive freedom, and because of SB 999, more women in California will have that security. That's why NARAL Pro-Choice California was so proud to co-sponsor this bill, and I want to thank Senator Pavley and her staff for all of their hard work on this, and Senator Hertzberg, and all our partners who made this possible. Also, thank you to all the legislators who voted in favor of this and to Governor Brown for signing it into law. We all know we have busy lives and that juggling work and school and kids can make it very easy to miss a day or two when you need to pick up your prescription at the pharmacy. That's how unintended pregnancies happen. By making this law in California, we're saying that we trust women to lead the lives that we want to lead. We're saying that we understand the daily struggles that we all deal with, and that we as a state are committed to removing unnecessary barriers to reproductive health care. We in California are recognizing that women's equality and economic security are not possible without reliable access to effective birth control. This law puts the power back where it belongs, in the hands of California women. The ability to control our reproductive lives is the ability to determine our futures, which is why we're so proud to be a part of this victory today. Thank you.
Now it's my pleasure to introduce Amy Moy, Vice President of Public Affairs at Essential Access Health, formerly California Family Health Council. They just switched their names, changed their names yesterday. Lots going on in the area of reproductive health. This organization may have changed its name yesterday, but they continue to remain the most committed to advancing women's health access in the state of California. With this mission, it's no surprise that Essential Access Health proudly co-sponsored Senate Bill 999. Please welcome Amy Moy.
Thank you, Celinda, and thank you, Corinne and El Proyecto, for hosting us here today. Good afternoon. As Celinda said, my name is Amy Moy, and I'm Vice President of Public Affairs at Essential Access Health. At Essential Access, we champion and promote quality sexual and reproductive health care for all, and we run California's Title X Federal Family Planning Program, and through that program, we partner with over 70 healthcare organizations that collectively serve over 1 million women, men, and teens each year throughout the state with quality sexual and reproductive health care. And we were proud to co-sponsor SB999, and it was a pleasure and a privilege to work with the senator. Thank you for your leadership and her staff. Another shout out to Elise for being a wonderful partner with this as well. And also thank you, Senator Hertzberg, for your support of this measure and also your support for women's health and leadership over the past many years. Women with public and private healthcare coverage need and deserve equal access to quality sexual and reproductive health care and their prescribed birth control method of choice. SB 999, as the Senator said, is common sense legislation that will help ensure that women in California get evidence-based contraceptive care regardless of their insurance coverage. As the Senator noted, the research is very clear. Providing an annual supply of contraception is a significant contributor to reducing unintended pregnancies and saving state dollars along the way. All women in California should have access to best practices when it comes to contraception and the ability to safely and effectively plan their pregnancies. And SB 999 recognizes that women lead busy lives, and it reduces this unnecessary hurdle of, as was mentioned, having to go to the pharmacy every month or every 3 months to get their birth control, which, as also was noted, is potentially life-changing medication if not taken consistently or if it's missed. As leaders in California, like our wonderful leaders here today, have long understood, increasing access to birth control is good for women, for families, and the health of our state. The bill continues California's leadership and long commitment to breaking down barriers to reproductive health access and advancing policy solutions that help reduce unintended pregnancies. We are absolutely thrilled that starting January 1st, 2017, as the Senator noted as well, women in California will have one less thing to worry about. And we will do everything that we can with our partner organizations to help increase awareness about this new advancement in women's health and rights. Thank you.
And I get to make a few remarks on behalf of Planned Parenthood. And I really want to actually give a shout out to my colleagues in Sacramento. Our Sacramento team were on the ground working with Senator Pavley's office and with the other partners to make sure that we did everything we could as a sponsor, co-sponsor, to get it to the finish line. Again, my name is Celinda, and Planned Parenthood Los Angeles has 20 health centers throughout the Los Angeles County. We see over 250,000 patient visits a year. Our patients, 90% of our patients are women, and most of them are coming to us for birth control. Our patients are incredibly diverse. They're single, they're married, they have children, they don't have children, but one thing is incredibly common. They want to plan when they have children, if and when they have children. And every day in our health centers, we hear some of the frustrations that the constituents that wrote to you are experiencing. And it's really difficult for our patients sometimes to get back into the health center. Again, as I mentioned, I know in my own life, it's incredibly busy. It's an incredibly busy life with 2 little ones, working full-time. But I have a flexible job, right? I can go to the doctor and I can take care of my business, but a lot of our patients are working multiple jobs. A lot of them are depending on public transportation. And so This is going to make a tremendous impact in the lives of women and families, and those in particular that we serve and we see every single day expressing their frustration. Women across California are busy, and like I mentioned, they're juggling multiple things, childcare, jobs. SB999 will really make a tangible difference in their lives. And getting a 1-year supply of birth control will really enable women to use their prescription consistently. As the senator said, you need this prescription not to be interrupted, and therefore this legislation would help in that. We are honored to stand alongside NARAL and alongside Essential Access Health. I'm proud to have the legislators that we do in our state of California, the champions. And as we're experiencing right now with the national landscape, we have seen a tremendous amount of attacks on women's health and on birth control. And it is California that is the beacon of hope for so many women, and really honestly for the entire country, especially right now. So thank you so much to these two leaders, and for Governor Brown, who understood the importance of advancing women's health and making that a priority. Thank you, Mr. Governor. And now I'd like to introduce Dr. Carmen Tatulian. She is the medical director here at El Barrio. El Proyecto has, as I said earlier, has provided services in the San Fernando community with many resources, including healthcare. And she's here to tell us how important it is for women to have access to birth control. And of course, she's been in this role for 8 years. So welcome, Dr. Tatulian.
As a doctor, as a healthcare provider, I know how important it is for women to have the ability to plan and space their pregnancies. Studies have shown that family planning has health benefits for both, for mother and for the newborns, because it can reduce the complications and it can reduce the prematurity and low birth weight. As a doctor, I also know that there is no medical reason to limit to 1 month or 3 months of the prescription dispensing the birth control pills. And many women successfully uses it for many years. So different types of the contraception, and reduces providing the annual, not for 1 month, not for 3 months, but annual for 12 months supply, reduces the chances of delayed refills and inconsistency, and this is important. And 1% failure rate is registered if they are correctly using the birth control pills. It's not only one size fit to everybody. People lead different lifestyles, and so what works perfectly for one person may not work for another. Thankfully, the variety of birth control pills, and I'm so happy, and I can say enough thank you that you made it happen. They so bill covers not only birth control pills, but also gives opportunity to cover for vaginal ring and also contraceptive patch. So we have a different choices for our patients, extremely important. So all these hormonal contraceptives methods are safe to provide for 12 months period of time, and we can trust women to discuss their birth control options together with their provider and pick the method that is right for them, for their lifestyle, and safely, effectively use products from their home. I also would like to mention that not only birth control pills is beneficial for the prevention of the pregnancy and to manage their lifestyle, but also in many occasions they're used for different conditions like endometriosis or polycystic ovarian syndrome, also using for the managing the period And whatever women reason for using birth control, we have a bill that help to get the medication that they need and to stay healthy. Thank you everybody who made this day happen. And I want to say thank you on behalf of my colleagues, healthcare providers, and also all our patients that don't have a chance to be here. Thank you.
Thank you. Our last speaker, but certainly not least, is Sarah Garcia, a peer advocate for Planned Parenthood Los Angeles. The peer advocates are a group of young women and men who receive training and education from Planned Parenthood Los Angeles, and then they go out into their community and they are resources of sexual information for their classmates and communities and even their families. It's a powerful model. Sarah's here today to share her story and her perspective and what this bill means for women across our state. Sarah.
Hello. As much as I was preparing for that, this feeling never did feel. All right. Salutations. My name is Sara Garcia, and I am honored and proud to be a voice for women all over California who will benefit from this bill. I recently graduated from Hollywood High this summer in June, and now attending Los Angeles City College in hopes to transfer to UCLA to study linguistics, film, and computer science. Thank you. I became involved with Planned Parenthood Los Angeles in the summer of my junior to senior year. And the Peer Advocate program helps teens like myself to become trusted leaders among peers who share accurate information on all things involving sexual health. As we all know, life can get pretty hectic, especially in today's society. We go to school to get a good job, then we get a car to go to the job to pay for the car and school. It's like, sometimes we take our health for granted. So at least for women now, they can go for a year with one less worry, like many people have said, because it's true. Earlier this year, I was able to use my voice when I traveled to Sacramento with Planned Parenthood for their annual Capitol Day. I was able to point out why SB999 was crucial to women all around California. Today feels amazing knowing that people in position of power have put that power to good use. Senator Pavley, Senator Hertzberg, thank you for fighting to make sure that women like me have the ability to plan our families and our future. I know that reducing barriers to accessing birth control reduces a woman's chance of having an unintended pregnancy by 30%. That's a lot. It's almost 50, right? 20. As a young woman, I deserve the ability to plan my family, including if and when I want to have children and form a family. So this bill is good for me and good for all women. Thanks again, Governor Brown, Senator Pavley, and Senator Hertzberg for listening to me and a million other women in California. And this is just another step to equity for all genders. This is very important, and fight on. Thank you so much.
So Sara, when you go to UCLA, you have to be careful with fight on, but you're gonna still fight on. That concludes our press conference. Thank you so much for joining us today in honor of women's health and advancing women's health. I want to especially thank the community partners, the elected officials who are here to make sure that our state is moving forward and protecting and advancing women's health. Your dedication and commitment to our communities is inspiring. Con esto concluye nuestra conferencia de prensa. Muchas gracias por acompañarnos hoy en honor de la salud de las mujeres. Quiero agradecer especialmente a todos los colegas y legisladores aquí que están dirigiendo nuestro estado para adelante. La dedicación a nuestras comunidades es un inspirador. Now, we're going to do a quick picture and then do a quick Q&A with the media. So those that spoke in the program, please join us here at the podium. welcome if you can welcome a picture or two. Corinne.